Most Armenians in the United States, there are a few older Armenians who speak English, most everybody. Yeah. So if it's going to be in the United States, the English is the language that people use. Well, this is another trip to Armenia. I come to Armenia about twice a year now. I first came to Armenia in 2007, and this is probably my 15th or 16th or 20th visit to Armenia. I first came to Armenia 11 years ago. I was urged to come by one of my professors, Professor Edgar Hosepian. Professor Hosepian was a neurosurgeon at Columbia, my medical school. He first came to Armenia at the time of the earthquake in 1988. And when Dr. Hosepian came to Armenia, he came again and again and again and again. And he told me to come to Armenia. So many years later, I came. And as it happened with Dr. Hosepian, when I came to Armenia, I had a very important feeling about this homeland. And remember that my parents had never been in Armenia. My parents were from Turkey, and after the genocide, they came to the United States. So the very interesting situation, my parents had never been to Armenia, and here I come to Armenia for the first time in 2007, and the feeling that I am talking about was very, very special. This is an ancestral homeland. When I came, it occurred to me that I might be able, through my own specialty of medicine, to help the people of Armenia. My specialty is in endocrinology. In particular, my subspecialty is in metabolic bone disease and osteoporosis. At the time of that first visit, I was impressed with how little knowledge there was among doctors, among healthcare professionals, and among patients about osteoporosis. It occurred to me also that there was no way to make the diagnosis of osteoporosis in Armenia before the fracture occurs, because there were no bone density machines. There was one. There was one bone density machine in a country of 3 million people. So I had two missions. One was to provide knowledge about osteoporosis to the doctors and healthcare professionals in Armenia, and two, to bring these bone density machines and place them throughout Armenia so that the doctors could do this test and diagnose osteoporosis and then take better care of the women and, in some cases, men who have osteoporosis. The company in the United States that sells this machine, bone density machine, I know, and I called the company and I said, I need a machine for the country of Armenia. I told them that these are very expensive machines that I cannot afford, and I want you to give me one for the people. And this was in 2007, and we placed our first machine, the gift from the Hologic company, to the Makarian Hospital. Every year, I called the company, and I said to them, I need another machine. Every year, another machine. Every year, another machine. And about 4 years ago, I called and they said, you want another machine? And I said, no. And they said, well, what do you want? And I said, I want two. So now, Armenia has 10 machines. Now, that may not seem like a lot, but for a small country, we now have more DEXA machines per capita than any other country in Eurasia, including Russia. Now, of course, it's nice to have the equipment and the capability, but we also needed to educate the doctors so that they knew how to interpret the test and had some knowledge of osteoporosis. The machines alone are not going to take care of people. So along with bringing machines to Armenia, I brought education. And in this regard, every year we have had an osteoporosis symposium where we teach the doctors the very latest about this disease. The doctors who teach initially were Armenian American doctors from the United States, and they still come with me every year. But more recently, the doctors here in Armenia have become part of my faculty. So now we have a very nice mix of Armenian American doctors coming from the United States and Armenian doctors here in Armenia who work together for this annual osteoporosis symposium. And one reason I'm here now is to plan the 12th annual osteoporosis symposium that will be held in October of this year. There are two other areas that I'd like to mention in this regard. One is what we call outreach. This means that we want to have not just the doctors know about this disease, but we want the people to know about it. This is a very, very important concept, because if patients don't know about this disease and the doctor says, well, you have this wrong with you, it doesn't register. So outreach, making the Armenian people in this country aware of the importance of this disease, was a very important mission. So let me say, I only come to Armenia twice a year, and these needs are occurring every day. We need to continually make this issue known. The Osteoporosis Association of Armenia, run by Varta Babalyan, is one of the most active associations in the entire world. The Osteoporosis Association of Armenia is an important part of the International Osteoporosis Foundation. And in fact, Varta has received recognition for all the work that she has done to make this disease known in the whole country. One thing I've learned over the past 11 years is that visions to develop a program are never very big. We start very small, and things grow and grow and grow. And a few years ago, it occurred to us that we've grown so big that we need to have not just an association, but we need in Armenia a center for osteoporosis in Armenia. And we are here. This is the Osteoporosis Center of Armenia. Director is Varta Babalyan, and it has defined our activities in ways that we would never have imagined 10 years ago. I mentioned the Hologic Company as a very generous supporter by contributing bone density machines. I think I should also mention that support for this program has also been enabled by generous foundations in the United States. The Hovnanian Foundation has been very generous. The JHM Foundation in the United States has been very generous. I have patients who have learned about what I'm doing, and they're not all Armenians. People who I take care of, they're not Armenian, and they say, I want to help you. And I think the point I'm making is that if you believe in something, people will help you. And that's what's happened. very hard to assess knowledge. But I think there are several ways in which we can. The first is at the annual osteoporosis symposium that we have, there are many opportunities for the local doctors to ask questions. And 10 years ago, there were no questions. They didn't know enough to ask a question. Now, the questions are coming, and they're very good, they're very challenging, and clearly the doctors in Armenia now know enough to ask questions, and good questions. The second way of assessing knowledge speaks to what I said earlier. When I first started, with due respect to the doctors in Armenia, there really were none who I felt confident could be part of my faculty, honestly. Now, half of the faculty are local Armenian doctors who know a lot. So that's another sign that we have taught, and the teachers are now the teaching others. As far as actual assessment of medical knowledge, we actually are thinking about doing some outcomes research to try to define what you asked a little bit better. But I think I can answer your question to say, yes, the level of knowledge of the average doctor, and again, with Varta's work with outreach, Varta has regular educational programs here at the center. She has so many people coming that she can't have everybody come. There's not enough room. That's another sign of great interest in the local doctors wanting to learn as much as they can, and they are. Now that is a very different condition from osteoporosis. And by the way, a lot of people don't know the difference, but it's a big difference. I wish that there were ways to treat osteoarthritis as effectively as there are ways to treat osteoporosis. Unfortunately, our approaches are limited, but there are medications that can work. There are local injections of medications that can work. And unfortunately, sometimes joint replacement is necessary. The question is, do I take care of patients with osteoporosis in the United States? And the answer is yes, I do. I am a doctor who has a practice. I take care of patients. But I also have what I call, where I'm an academic doctor. I'm a university professor, which means that I do a lot of research, write a lot of research papers, and edit a lot of books. So my practice is limited. I don't see patients all the time. But that gives me an opportunity, as we say, to be a thought leader and to come to Armenia and to educate others. Your question about in the United States, can we treat osteoporosis and is it affordable? And the answer is yes. The answer is yes. In the United States, most patients have insurance, medical insurance. And in the United States, which is different from Armenia, I believe, the medical insurance covers the cost of drugs or medications. Sometimes it's complicated to get approval for some of the medications we have. But the good news is that we have medications that are safe, effective, and affordable. So in the US, yes, if I see a patient who has osteoporosis and I choose to use a treatment, a medication, I almost always can provide that medicine for that patient and that it can be affordable. The disease has certain risk factors, we say. What are those risk factors? One of them is your genetics. We're born with our genes, and there's a very strong family history of osteoporosis. One of the first questions I ask patients is, did your mother have osteoporosis? Did your father? Did your grandmother? So family history is important. Now, we can't do anything about family history. Family history is family history. Genes are your genes. But on the other hand, there are things we can do something about. Nutrition. Yes, nutrition can be very important. People who don't get enough calcium in their diet, that can make them more at risk for osteoporosis. And we can do something about nutrition. Other things, for example, smoking. I will say about smoking, about Armenia, I think finally, maybe in this country, people are getting the message that smoking is very bad, not just for your bones, but for your heart, for your brain, for lung cancer. Armenia is way behind many parts of the world where smoking continues to be a big problem, and smoking is a risk factor for osteoporosis. Another risk factor is alcohol. Now, a glass of wine is fine, beer is fine, but too much of it can be bad. So we have that as another risk factor. There's a very common medication that's used for arthritis. These are called glucocorticoids, prednisone or prednisolone. And unfortunately, people who need that medication for their arthritis or their lung disease can be at risk for osteoporosis. I should also mention, when we talk about genes, whether you're a woman or a man, women are at greater risk for osteoporosis. And the interesting point is, it isn't just being a woman, it's being a postmenopausal woman. So the menopause, when women become estrogen deficient, that's a very important sex hormone. That's the reason why women, that is the primary reason why women are at greater risk for osteoporosis than men, is because women have a natural menopause. Most women don't take estrogen after the menopause, and that leads to increased risk of bone loss. It is true that younger women under 50 who are still having periods and have good estrogen levels, it is true that some younger women get osteoporosis. At Columbia, we have actually a very big research program to try to understand why, because it's not clear. Some of these women have had an eating disorder when they were younger. They lost a lot of weight and did lose their periods for a period of time. But yes, the answer is we do see it in younger women, and we see it in younger men too. But we really don't understand the mechanisms by which that occurs in younger people. One more thing I would like to say about the vision of Armenia and how our vision can become greater as we progress. And in this regard, a few years ago, we held an international summit meeting here in Armenia. We had 13 countries, some from former Soviet Union countries, Russian-speaking countries, and some from Eastern Europe. They all came to Armenia to talk about what their countries are doing insofar as improving awareness of the disease. So I began to realize then, and further with the activities that Dr. Babalyan has been beautifully developing, the greater awareness of Armenia with regard to the International Osteoporosis Foundation. And third, that we are going to have our second international summit in October, where we plan to bring 20 countries. What I am trying to say is that what we have done is to make Armenia a center throughout the entire region of this field. So I think this is wonderful, that we are making our country known throughout Eurasia as the place to go to learn about osteoporosis.